what every woman should know about toxic shock syndrome. Toxic shock syndrome (TSS). It's the life-threatening illness we're all programmed to be scared shitless of yet rarely think about unless it's in the news. There was 24-year-old model Lauren Wasser who lost her leg a few years ago to TSS, and the 13-year-old British teen who died a few months back from the illness. Freaky and rare stories, to be sure, but what's the average gal gotta know to stay safe? Here are the key points to protect yourself with. It's not just caused by tampons. Toxic shock occurs when toxins produced by certain strains of Staphylococcus bacteria invade the body, leading to a sudden high fever, rash, and other life-threatening complications. And while up to half of TSS cases can be attributed to a tampon, the fibers in them take on that bacteria and cause it to grow. It can also be caused by other open wounds, like a scrape or bug bite, says Diana Hopp, MD, an obgyn based in Encinitas, California. It's really, really rare. Think about all the people you know who use tampons or have had a cut on their body. So everybody. Last year, there were only 26 cases of TSS reported in the U.S., according to the Centers for Disease Control and Prevention. In all my years of practice I've never seen a case of TSS, says Hopp. It's extremely unlikely you or anyone you know will have TSS, but that doesn't mean you shouldn't do what you can to reduce your teeny-tiny risk. Symptoms can be similar to the flu: a sudden onset of high fever over 102 degrees, vomiting, diarrhea, a rash especially on your palms or the soles of your feet, muscle aches, low blood pressure, headaches. These are all symptoms of toxic shock. Since infection spreads quickly and can lead to issues like organ failure, reduced blood flow, and even death, it's best to get into a doctor's stat if you suspect something's off, says Hopp. Follow the 4 to 8 hour rule. We've seen a lot of women who have forgotten to remove their tampons for as long as a week or two, and they haven't had toxic shock, says Hopp. Or are you going to be fine if you forget to change it for 12 hours? Probably. But the recommendation is 8 hours max to be safe. If you sleep longer than 8 hours, use a pad. It's also a good idea to use the lowest absorbency tampon possible and keep all skin wounds clean, whether you've just had surgery or are dealing with a small cut. One last note: if you've suffered from TSS before, you could be prone to contracting it again, so chat with your doctor before getting back on the tampon wagon.